As you probably know, we have a virus going on, a coronavirus, and people are of course very curious about how they should deal with it. So let's talk about the coronavirus. We have a number of coronaviruses, and the SARS and the MERS were coronaviruses, and they had, especially SARS had a very high mortality rate. We'll talk about that. It spread from person to person, and especially when an infected person sneezes or coughs, it can distribute droplets into the air, and it can be inhaled by other people, or it can come on the hands or the body of the patient, and thereby also transmit to other persons, person to person. So droplets and direct contact between person to person, and people within around 2 meters distance are in danger of or at risk of getting coronavirus from an infected person through the sneezing and the coughing. So there is some suspicion that maybe contaminated surfaces can also lead to spread of the virus. For instance, door handles, remote controls, driving wheels, and so on. It has an incubation date of 4 to 7 days on average, which means that from the time that you're infected to you start getting symptoms, the average is 4 to 7 days before you get the symptoms. But there have been a case reported with 12.5 days of incubation, so that the patient was infected 12.5 days earlier and then developed symptoms later. As it is presently, the data may change. We might have to review this and revise the numbers, but presently it's like the number of people that are infected doubles every 1 week, and one patient infects on average 2.2 other persons. The signs and symptoms of the virus is nearly all patients have fever. 3/4 of the patients have coughing, and around half of the patients will have myalgia and pain, fatigue. They can also have breathing problems and lymphopenia, which means that their lymphocytes in the blood, the number of the lymphocytes go down. It is, as from the data we have now, it's less fatal than the SARS virus, and the fatality rate and mortality rate stands at 2 to 3%. We don't know if the numbers are actually quite correct or not. SARS had a mortality rate of 10%. As of 11th of February, today, we have more than 40,000 people that are infected, and we have more than 1,000 deaths. There is no specific antiviral treatment. We don't have anything that can do away with the virus itself. So the treatment is basically supportive, as it would be in many other viral infections, influenza and SARS and MERS. It is supportive treatment, so if the patient has difficulty breathing, we'll support his lungs, and if there's a temperature, we'll give something to reduce the temperature if it goes too high. If there are complications, bacterial complications, they will need to treat those also. So, but no treatment that would do away with the infection itself, the virus itself. So how do you avoid getting the infection? Well, you should try to avoid contact with patients. Also, you should try to not touch your eyes, nose, or mouth without washing your hands first. And if you touch your eye, nose, and mouth, you should also wash your hands. Even if you do not have any symptoms, you wouldn't know if you have gotten the virus on your hands or not. If you cough or sneeze into a tissue or a number of tissues, it should not, they should not be already wet, so that it doesn't transmit through the tissue to your hands. So cough or sneeze into a tissue, or you can use your arms also to, if you don't have a tissue, to cough or sneeze. Patients should be wearing face masks. There's really nothing that makes us believe that people otherwise should be using the normal face mask. It's quite important with frequent hand wash, and you should wash your hands with soap for at least 30 seconds. If soap is not available, if it's not possible to wash your hands, then you can use a sanitizer with a minimum 60% alcohol. If you're infected or you suspect that you're infected, I think we have a typo here, then you stay home, and if possible, you stay in one room if you're living with other people. If possible, use a separate bathroom, use a separate towel, so that other people in the household are not affected. The patient should be using a face mask, especially if dealing with other people, getting in contact with family members or household members. If you need to see the doctor, call the doctor beforehand and say that you are suspecting this infection, especially if you've been to China or been exposed to someone who might have had the infection. If you've been exposed to someone like that or been to China within the past 14 days. Frequent hand wash again is important, and if you don't have access to that, use 60% sanitizer, 60% alcohol sanitizer minimum. It can be more. Of course, you should minimize exposure to other people, so no traveling, no work, no school while you still have the symptoms. So this was a very brief introduction to the coronavirus. We have a more lengthy video on this, so do click the notification, do click the link up here if you want to see a more detailed video about the coronavirus. I'm Dr. Mazhar. Thank you.